Hello, my name is Dr. Caroline Walker, and for those of you who don't know me, I'm an NHS psychiatrist and I specialise in the well-being of doctors. I wanted to make a video about the evolving situation with COVID-19 and the impact that that is already having on the mental health and well-being of doctors, and what we can do to support one another as we face this really challenging time. I'm seeing a lot of different types of impact on doctors from the COVID-19 situation. Some doctors are experiencing increasing workloads. Some are having to work in very different ways, in very unfamiliar ways, which can be quite unsettling. Some are directly affected by fear of exposure to a known case, or actually being exposed themselves and or developing the illness themselves. There's also a more general level of increased anxiety and stress that I'm picking up in doctors at the moment, which I think is quite understandable and quite normal given the situation. And I think that's their own anxieties, but also carrying that kind of low-level anxiety that's around in the nation and in fact internationally at the moment. I think the two things that we can do to really help ourselves and support ourselves and our colleagues psychologically through these coming challenging times, these next few weeks and months, are one, to kind of understand and normalise the normal psychological response when something like this happens, and two, to look at some of the things that we can do to reduce our own levels of anxiety and stress. So I wanted to just talk briefly about those two things. So first of all, the normal psychological response to something like this. So it's very common when there's something going on of this magnitude, affecting a whole community and in fact worldwide, for us all to experience low-level symptoms of kind of increased stress and anxiety. So you might experience those physically, so you may get tension or nausea or palpitations, or just feeling very anxious sort of physically, or you may feel it more, experience it more as a kind of a thinking type of anxiety, like a worrying, so you may get sort of worst case scenario thinking going on about what will happen if this happens and that happens. Or you may notice that your behaviours are starting to change. So you might notice, for example, you're spending more time looking at social media and reading the news, and maybe you're checking excessively for symptoms in yourself or in your loved ones, or even more so in your patients. So it's really normal that we would all, most people would experience some sort of symptoms or reaction in the situation that we find ourselves in. And if you find that your levels of stress or anxiety seem a bit more than that, so say you are somebody who's already got a mental health problem or struggling with anxiety, or you're just getting very severe symptoms that are interrupting with your ability to function day to day, then please do know that there is support and help out there. Do get in touch with somebody to access that support. You can always email me at caroline@joyfuldoctor.com, and I'm happy to signpost you if you're a doctor who is struggling. So let's have a think about what we can do. Actually, if we notice that this is starting to get to us and it's starting to cause us more stress or anxiety. So the number one thing I recommend that everyone does is to reconnect with their support network. So, and we know this from working with people who've suffered from natural disasters or terrorist attacks or other incidences where there's been a wide-scale impact on people's health and well-being that's affected communities, that the most important thing we can do for individuals and for ourselves is to reconnect with our normal support networks. So that's our friends, our families, our colleagues, our other social groups like church groups or social gathering groups. Obviously doing that in a safe way physically, within the guidance of what the government's saying at the time around spending time face to face, but staying connected in other ways, where you can't meet face to face, really important, so by phone or virtually. So that's the number one tip, of staying connected with those in your support network. Number two, I would suggest trying to maintain as much of your day-to-day normal activity as possible given the circumstances. Really important that we keep grounded in those things that are normal for us when so much else is changing around us. Number 3, I would check in with yourself on how much you're using things like social media, or how much you're engaging with and reading and interacting with the information flow, like the 24-hour news cycle, because if we are doing that more and more and more, it can actually feed that feeling of anxiety within us. So just minimising that to the minimal amount possible. And finally, just checking in with yourself and with anyone you know that may be affected on a regular basis. So yeah, I just wanted to share really that, you know, doctors and other healthcare professionals are already starting to show the signs of struggling with the psychological impact of COVID-19, that it's normal for us to be feeling a bit stressed and anxious at the moment, but there are some simple things we can do to try to maintain our own well-being through the coming weeks and months. So please stay connected with your social networks. Look at how much you're interacting with the information flow and keep that to a minimum, and do check in with each other whenever you can, just to keep an eye out for yourself and your colleagues. Good luck with the coming weeks and months, and yeah, I hope this video has been helpful. Please share it if you think that it might help other doctors and healthcare professionals that you know. Bye for now.